Good afternoon, everyone. Welcome to another edition of NUS 891 podcast. My name is Oge Anoliefo, and I'll be facilitating this week's podcast. This week, we'll be discussing the topic called the decolonization of nursing knowledge and the future of nursing theories. The learning objective of this week's um, podcast is to describe the need for decolonizing the nursing knowledge, describe theoretical approaches that enable knowledge decolonization, describe feminism theory, define postcolonialism, and then consider your place in the future direction of nursing. So our first question would be, should nursing knowledge be decolonized? In order to discuss decolonization, we need to understand what colonization in nursing practice is and why the need for decolonization of nursing knowledge. In order to discuss decolonization, we need to understand what colonization in nursing practice is and why the need for decolonization of nursing knowledge. So according to a studies done by Peggy Chin in 2022, it stated that nursing practice has been colonized through imposing another person's ideas, practices, and dominant culture onto others. And mostly he identified that the population affected are the marginalized or indigenous group. He believed that these set of people are made to believe their own culture or health practice are inadequate and not efficient for health practices. Now, would you say that there is a need for decolonization of nursing knowledge? I guess we still need to understand what decolonization of nursing knowledge means in nursing practice. Now, Iheduru Anderson described decolonization of nursing knowledge as deconstructing colonial ideologies and unlearning Eurocentric perspectives and relearning in a new, inclusive manner that embraces historically marginalized knowledge systems and experiences. He also suggested that traditional nursing knowledge are largely shaped by Western scientific and medical perspective, which sometimes marginalizes or excludes other ways of knowing and healing that comes from diverse cultural, indigenous, and non-Western traditions to create a more inclusive, culturally sensitive, and holistic approach to healthcare. So the effect of this is that it challenges the dominating nature of Western-centric models and advocates for a broader understanding of health, which respects and incorporates diverse worldviews and experiences. Some of the key aspects of decolonizing nursing knowledge include understanding certain systemic racism and white privileges and creating counter narratives that dismantle colonized thinking. We also have the aspect of committing to action based on social justice and human rights. So to decolonize nursing knowledge, we need to understand some of the social determinants of health, like individual cultures and systemic inequalities, which could help us as nurses to advocate for policies and practices that addresses health inequalities and promotes a fair treatment for everyone, including the marginalized and vulnerable population. We also have the concept of unlearning Eurocentric perspectives embedded in nursing education. This concept stems from the fact that most of the modern nursing knowledge were created by Western biomedical and colonial frameworks. So, recognizing some of the biases and incorporating diverse worldviews and healing practices into nursing care is a step into decolonizing nursing knowledge. In this slide, we're just going to look at some of the benefits of decolonizing nursing knowledge, and some of them were like improved cultural competence and cultural safety, addressing health inequalities, empowering indigenous and marginalized communities, enhanced patient-centered care, better health outcome for indigenous and marginalized population, and promoting global health equity. There are also some drawbacks that can be identified with decolonizing nursing knowledge. One major drawback could be resistance to change from individuals or institutions who are already deeply embedded in the traditional colonial frameworks. So there could be the issue of skepticism towards non-Western healing practices and reluctance to challenge authorities in the healthcare hierarchies. Another barrier could be a lack of representatives who would advocate for changes in the nursing curriculum or policies and practices which can better reflect on decolonized knowledge, ensuring that the indigenous nurses from marginalized backgrounds have a voice in curriculum development and policy making. The last barrier I could identify was being able to balance cultural and non-Western healing practices so as to maintain a rigor of evidence-based practice. As we know, the key to better healthcare system is to maintain evidence-based practice. Having looked at the definition of decolonization of nursing knowledge and some of the benefits and drawbacks, just going to quickly look at the theoretical approaches that enable knowledge decolonization in nursing. So the first one is post-structuralism. This theory challenges the assumption that there are dominant medical knowledge that has been legitimized as the truth of healthcare. We also have the critical race theory. This theory, it provides a broad framework for understanding power dynamics, inequalities, and social change. So it encourages nurses to engage in reflective practice to understand how their own biases and power dynamics could influence patient care and advocate for change in healthcare delivery. We have the decolonial theory. This theory advocates for a shift towards epistemic justice, where knowledge from indigenous and marginalized groups is valued alongside Western scientific knowledge, which aligns with patient preferences. Then we have the feminist theory. This theory emphasizes the importance of considering gender, race, class, and other identities in analyzing oppression and power struggles. It critiques how traditional knowledge often marginalizes women, especially women of color. Thus, application would cause an advocacy for inclusion of women voices in shaping healthcare decisions, policies, and practices. Lastly, we're going to talk of the post-colonial theory. This theory critiques the lingering impact of colonialism by understanding the historical roots of healthcare inequalities. demeaning the traditional healing practices of the marginalized or indigenous population. What would you say would be the future of nursing theories? So nursing theories provide a foundation for clinical decision making. Just to recap, we have three types of nursing theories: the grand, middle, and the practical range. So the grand theories are the broadest of the three types of theories, and they offer a wide perspective on abstract concepts. The middle theories lie somewhere at the middle of the other two theories. It explains certain trends in clinical practice, while the practice level theories are more specific to patient needs or goals. Because they are so specific, they are directly impacting your daily nurse practice. Now, over the years, there has been little attention given to the grand theories. The future of nursing theories lies in the focus on improving patient outcome and patient satisfaction. Middle range theories have contributed to this development. Mary Jane Smith and patient Leah, in the text Middle Range Theory for Nursing, second edition, stated that with the development of middle range theories, there is evidence of a growth of knowledge development. And so, with the evolving of nursing towards specialization, theories are more geared to the bedside, and each nurse is expanding on their practice knowledge within their own specialty. So as such, we see that nurses, nurses are no longer master of everything like we would have thought, but continue to build on knowledge and skills within their area of specialty. So the middle range theories have more limited scope and address specific phenomena or concept, which paves a way for specific theories that address specific nursing phenomena in clinical practices and to specific population, which in ultimate will result in an improved patient outcome and quality of care within the nursing practice. So with this being said, it's difficult to actually predict the exact future of nursing theories, as the only constant thing in healthcare is change. As such, nurses go through changes and emerge with applicable theories for a stronger knowledge base in enhancing quality care. And they do this through skills they learn and knowledge. In this slide, these are just the questions we're going to be looking at for this week, just to increase our understanding on the topic that we discussed during this podcast. I encourage everyone to look at the questions and contribute to their best of their abilities, and I'll be there to provide my own contributions as well. These are the references I used for this podcast. Thank you so much for listening to this podcast. I will see you in the discussion question board. Bye for now.